First and foremost, I want to thank you for visiting our facility. Have you visited other clinics already? Okay. Well, I want to just give you some information about our practice and what kind of differs us from other practices that you may seek. For one, included in price of any procedure you go with is going to be pre and post-op consultation services. And the reason I strongly believe this is a necessity to add in, no additional charge, is because although these are elective procedures and they are not deemed medically necessary, it is proven that a person's self-image and self-perception directly affects how they function in their personal and professional lives and their mental and can be physical well-being. So I like to include that just as an added complimentary service to ease you into making the right choices for yourself. And if you do choose to go ahead with surgery after the fact, to help you navigate the post-operative kind of waters. I think a common misconception is that it's instantaneous gratification, and that is just simply not the case. Just like a piercing or possibly a tattoo or any sort of body modification or surgery, if you've ever had an actual medical procedure, there is a healing time, and it is often weeks to months. Some of our procedures can take up to a full year before the body will fully recover. And that's not to scare you, but give you realistic expectations. So it is very common to have post-op blues, and so I want my patients to feel supported both before, during, and after the procedures. Okay? Well, now that we've gone into a little bit about some of our additional services, please tell me a little bit more about what type of augmentation you're looking for, why, a little bit what you're hoping to achieve from that, and what I mean by that is larger bust, reduced bust, fuller bust, lifted bust. Okay, yeah, so you want maybe a cup or two larger, perky, fuller upper poles, what we call that nice slope that you get there, the kind of cleavage. Okay, now what about side boob? So where the breast, this kind of comes up on the side of the body. Is that something, look, you're interested in? That you want to steer away from? Oh, pictures are wonderful. Yeah. Let's take a look. You have your cell phone. Okay, yeah. Okay. I see. Okay. Well, I think those are some achievable, reasonable goals. Definitely some fullness, upper pole fullness. Now, the two pictures you showed me are actually a little different. One did show more side boob in the bikini, which is where she had a lot of fullness to the side of the bust. And that just is going to mean we would use a wider, lower projection implant. The other one, she had although the naturally bust is going to have curvature here, I didn't notice as much width, so less side boob, and she seemed to have more projection, so how far the bust comes out forward. Which of those two looks are you going for? Okay, so you want perky, and you don't want to appear too wide. Yeah, of course, a lot of fear or complaint that some women have is that they go with a wider implant to get lots of cleavage and side boob, not realizing that it can add some width. I don't think unattractive width, but I think it can be a bit of a shock. I'll know better what is going to achieve more projection and less fullness after I do a series of measurements. Now, the most common thing I hear is so many women coming in and they ask me for double Ds. Now, what usually they mean is they'll look the iconic look that we have been pitched of a double D. And the transparency and reality of that is that most of those women are much larger than a double D, and most women are measuring and wearing an incorrect bra size. In addition to our counseling services, I will give you some contact information post-operatively for a great tailor who specializes in bra fittings. Victoria's Secret doesn't often get it right, so we can measure you, but many of those women are into what seems scary sizes, but it's just because they're measuring correctly and really covering the bust and getting the right support larger bust need. So we'll make sure that you have the appropriate fit. That being said, we're going to take some measurements, and I'm going to be writing those down, and then we'll talk about the different implant heights, projections, and options, okay? Okay. So what I'm going to be looking for is if you have any ptosis. And what ptosis is breast sagging. Now, you seem very fit and beautiful, and I don't assume that underneath your garment there's going to be anything that it might require an extensive breast lift. However, more than just breastfeeding, many things can play into having some sagging, weight loss, and then gain, and then loss. If you have large bust naturally, and just gravity eventually will take its toll, so we'll measure for that. And so we're going to start with that by measuring from your sternal notch to the center of your nipple diagonally. So sternal notch is basically just the middle of your collarbone. We're going to be measuring in centimeters. Now, anything less than 20 centimeters between sternal notch and nipple, you'll absolutely not need a lift. 22, you may, depending on the amount of cc's or volume of the implant. If you go a little larger, you may be able to avoid a lift. And if you're over 23 centimeters, regardless of implant size, you would be recommended to do a lift, okay? So, let's start with again centimeters. Okay. Great. So you are 21 centimeters, and that means you absolutely do not need a breast lift. So we won't even get into that any further, okay? Now what we're going to do is measure your base width diameter. And what base width diameter is it is the distance between the side of your breast to the center. So all the way across the width of the breast. So basically from cleavage to the side. And what that's going to tell me is how wide our implant needs to be, because if we go too small and we don't fill the chest wall, it's not going to be a nice look. It will give you that very circular, very obviously augmented look. Not that that's anything wrong with that. I think that could be a very nice look on some women, if that's what you want. But we'll just have a better idea. So, okay. You are 12 centimeter base width diameter. What that means is you're in the average range. The average woman is between 11 and 13. And what's nice about that is it's going to give you a lot of options. For instance, I have a very wide chest. I have a 15 centimeter base width diameter, and that just meant that my options were different. I wouldn't say limited, but different. With you, that means we can do a variety of different things. We can go with and I apologize for sanitation purposes. We have not been bringing out the testers, the silicone implants themselves, just for hygienic purposes with COVID restrictions, but I'll explain. So I'll draw you a little bit of diagram here. So now I apologize, I'm not an artist, but you can see here, these are my very unprofessional diagrams. Here I demonstrated a low profile implant, and that means it's going to have a very wide base and it's going to have low projection. It's going to give you lots of side boob and sit very close to the bottom. You don't see a lot of women opting for low profile unless they either have very minimal breast tissue or they want a very, very natural look. Most popular are between these two. This is a moderate profile, so it has slight more projection, slightly less width, but still gives a lot of cleavage inside boob. Next is our moderate plus. It's somewhere in between these two, obviously. It's going to give you slightly more projection, be a little bit narrower. And then we have high profile. High profile is going to have a narrow width and much more projection. So you're going to get a lot less side boob, and the breast will project more. And then you have ultra high profile. Narrowest base, which I didn't do a good job of demonstrating. Narrowest width, highest projection. And that is going to give you minimal side boob and the optimal projection from the chest. Some women will say that that will give you the fakest look, but it's all based on your measurements. Based on what you have, I think a moderate plus to a ultra high profile could be a great selection for you, because you are not too wide, so we don't have to steer away from higher projection, and you are not too narrow, we have to use high projection, so you really get a choice. Now, most common one these days is high profile, and that's because you're going to get a good amount with your base width, some side boob, some good amount of projection. This doesn't seem underwhelming or overwhelming. An ultra high profile, personally, I think it can be wonderful for minimizing width, but you are not a very wide person, so I wouldn't really say that's something you need to worry about with any implant you choose. Do you have any thoughts or questions? If I may make a recommendation based on your pictures and your measurements, I would say around 420 to 450 cc high profiles would be beautiful. Now, if you're having and being stuck on choosing higher or lower, 50 cc's is just a few tablespoons. It will visually almost make no difference, but the biggest regret many women have is going too small. And so I feel personally, again, for the mental aspect, for peace of mind, to feeling like you made it worth your financially made it worth your while, as well as all the recovery, if you're choosing between the lower or the higher, and it's not more than 75 cc's. Most women end up happier going with the higher number, even though visually it may not be very obvious that there's a difference. Okay. Alright, well, just to kind of summarize, we are going to be able to provide you pre- and post-op counseling services for any insecurities or concerns. Of course, if there's actual concerns, if you do go with us after the procedure post-op, definitely get in touch with me or our charge nurse. I am going to provide you my direct cell phone number as well as her work cell number, so you can reach us, either of us, at any time of the day. Okay. Now, the charge nurse does have working hours that are different than mine. I'm always available, but she may respond quicker if I'm in with a patient, okay? So let me just write that down for you. Our nurse's name is Nurse Jasmine. She's wonderful, been with us for a very long time. Okay, so I have I'm also going to be providing you a list of post and pre-op and post instructions for you to review. Now, I always take the assumptive approach to assume that you are going to be very happy in becoming to us. So I like to give everyone everything they need right away. So if you do end up with questions, we can get on those quickly. The main things are after surgery, you're going to leave your chest dressings on, and I will remove those at the next morning post-op appointment. You can then, after I examine you and clear you, undress. I will be giving you a post-op bra that you will be wearing for the better half of 6 weeks. I would recommend buying another front closure bra, so you have one that you can in the wash and one to be wearing, so you're always staying sanitary with your incisions, okay? But you can remove that and shower. You will need to use antibacterial soap on your incisions. That is something I almost forgot. We have options in terms of incision, depending on how you want to go. We can go areolar, which is where we make an incision through the nipple, and we put the implant through the nipple. It is going to have the minimal amount of scarring, and depending on how you personally scar, it can either be next to not visible or very minimally visible. Or we can go into the inframammary fold, which is right below the bust. Larger incision, but you don't have the increased risk of desensitized nipple sensation. Inframammary, absolutely. Back to postoperatively. Again, you're going to want to wear the front closure bra for 6 weeks or until you are comfortable, but no less than 6 weeks. You are going to need to sleep elevated, so many pillows, also for 6 weeks to minimize swelling and have the drop in unfluff process begin. Now, drop in fluff means when you first get implants, they're going to sit very high and unnatural. That's normal. Your muscles will relax. We do everything here under the muscle, unless you have other wishes. We just feel like it's the most natural look, and as your muscle relaxes, the implant will soften and drop into a much more natural, flattering position. So, sleeping elevated will allow gravity to work faster for you, okay? After surgery, I recommend a gallon of water every single day before surgery, and a gallon of water every single day for the first 6 weeks. Now, I know that seems intimidating, but it is going to expedite the healing process for you. And the trick is to get your gallon and pour it into a normal 16-ounce cup. Drinking several small cups, even though you're drinking the same amount of water, mentally much more doable than trying to chug out of your gallon. I do it personally. Wonderful trick. You're going to get 3 prescriptions. You're going to get an anti-nausea medication, a pain reliever, and an antibiotic. You will need to take the antibiotic in full until it's completed. Pain relievers and nausea medication will be as needed. I will be giving you an anti-nausea patch that will go behind the ear, and you will wear that for the first 72 hours after surgery, so you shouldn't need the additional nausea medication unless, again, you just feel you really need it. I would definitely recommend to discontinue the pain reliever as soon as it can tolerate, because it will cause bloat, water retention, and possibly constipation, which can add to your overall discomfort, but it is going to be very necessary for at least that first 48 hours, okay? We don't want to cause any sort of dependency. Okay, well, I think I've covered everything that I need. I'm going to hand over the folder